Word of the week, osteochondritis dissecans. That's a mouthful. Let me talk a bit about the origin of the word. The word osteo is Greek for meaning bone. Chondrite or chond, means cartilage, and then itis means inflammation. So osteo is from osteon. The chondr is Greek from chondros, meaning cartilage. And then the itis is a Greek suffix meaning inflammation. The word dissecans comes from the Latin word to dessecare, which means to cut or separate. And let me just show you an example of what these look like. Osteochondritis dissecans is most common between the ages of 10 and 15, more common in males than females. We think it comes from microtrauma. We see it commonly in the knee, the elbow, and less commonly in the ankle. But this is what it will look like. So this is a T1 view of a knee. This is an AP view. This area is where the bone is beginning to die and will begin to separate from this area of the femoral condyle. This is a T2 image, and you can actually see that there's fluid behind the osteochondritis dissecans area right here, but the overlying cartilage looks like it is intact on this view. Plain x-rays, and this is an elbow, an AP of an elbow, and the red arrows show where the area of osteochondritis dissecans is located here, which is the capitellum, the distal part of the humerus that lines up with the radial head. And this area of cystic changes is where the bone is beginning to die. We treat this initially making the student athlete non-weight bearing because it tends to be kids who do a lot of repetitive trauma, whether it's gymnasts for the arms or runners for the knee or ankles. We get the weight off of that joint. On occasion, we have to go in there surgically and fix that area by placing some biocomposite screws to hold it in place. So that's the origin of the word of osteochondritis dissecans, who gets it, and how we treat it.